Just how long can you hold your breath? And have you ever tried to train yourself to hold your breath for longer? Is it even possible?
Hey there. In this lesson, we're going to talk about regulation of the respiratory system as well as some respiratory disorders. So regulating the respiratory system depends primarily on control centers in the medulla and pons of the brain. Now, these are really primal parts of the brain because we have an utmost need to regulate our respiratory system, and it doesn't matter how evolved of an animal you happen to be, this needs to happen. Breathing is regulated so that the levels of oxygen, carbon dioxide, and acid are kept within normal limits for homeostasis. And the phrenic nerve connects the medulla at the very base of our brain to our diaphragm. And then the diaphragm and other muscles of the respiratory system are voluntary in the sense that they can be regulated also from our higher brain center, so we can voluntarily hold our breath. But it would be incredibly hard to hold your breath long enough until you passed out because of the phrenic nerve and the regulation by the medulla. So chemoreceptors are nerve receptors that are sensitive to specific chemicals. So we can have olfactory nerve receptors in our nose, chemoreceptors on our tongue that are responsible for taste, and we also have chemoreceptors used to regulate breathing. So we have carbon dioxide or acid chemoreceptors. So when carbon dioxide dissolves in the lungs, it forms a weak acid. When the acid levels in the blood are too high, receptors in the medulla trigger an increase in breathing rates. So if we've been working or exercising and using more oxygen and producing more carbon dioxide, our medulla oblongata tells our body that we need to increase our breathing rates to get rid of that excess carbon dioxide in our blood so that our blood doesn't become too acidic. So the carbon dioxide chemoreceptors in the medulla oblongata, again at the base of your brain, are the primary regulatory system. So it's not a lack of oxygen, it is an increase of carbon dioxide in our blood that regulates our breathing system. So we need to get rid of this acid in our blood. So when those carbon dioxide levels are too high, an acceleration of breathing is triggered. So we also have a backup system consisted of the carotid and aortic bodies. These receptors detect low levels of oxygen in the blood and tell the medulla to increase breathing rate. But this is a backup system. Our primary one is the chemoreceptors in the medulla responding to rates of carbon dioxide in the blood. So for example, like we said, if you hold your breath, this is a primary and secondary response. So our carbon dioxide levels are going to rise and our oxygen levels are going to drop. The high carbon dioxide levels resulting in high acid trigger an increase in breathing. And this is going to be our primary and secondary response when we hold our breath. However, if we are in a high altitude situation, so if you're hiking, the carbon dioxide levels in your body are remaining constant. However, the lower oxygen levels due to a lower air pressure, because we're higher up in the mountains, then will trigger that secondary regulatory system, which is going to initiate higher breathing levels. We talked about carbon monoxide when we talked about enzymes. And the carbon monoxide poisoning, again, occurs when carbon monoxide outcompetes oxygen for binding sites on hemoglobin. And the low oxygen triggers are carotid and aortic bodies, which cause an increase in breathing rate. Unfortunately, because our body preferentially attaches to carbon monoxide on our hemoglobin, this further increases our carbon monoxide concentration. So it's very important to get a carbon monoxide detector for your house. They should be kept on a floor level instead of a ceiling level because carbon monoxide is denser than air. So you want to have it a low level on your floor in your basement if possible to alert you if there's an increase in carbon monoxide in your living environment. So gas exchange and transport from the lungs to the blood and from the cells to the blood occurs by simple diffusion along pressure gradients. So when we talk about partial pressure, this is the individual pressure exerted by particular gases within a mixture of other gases. So it would be oxygen compared to oxygen, carbon dioxide compared to carbon dioxide. So the body is continually going to be using up oxygen during cellular respiration. So the tissues and veins have the lowest oxygen partial pressure because the veins are going back to the heart and the oxygen has been taken out of the blood at that point. The alveoli have a partial pressure of oxygen around 15 kilopascals because that is where the oxygen is going to be the highest. because it hasn't been absorbed by the tissues and veins yet. The partial pressure of carbon dioxide is just the opposite. It's going to be low in the alveoli because it won't be high in the atmospheric air, but it's high in the tissues and veins because it will have been produced during cellular respiration, and then the veins are going to be transporting it back to the heart and lungs. So not enough oxygen can diffuse into the blood plasma for cellular use, so it's not an effective way to transport blood, so the body needs a lot more. So oxygen is going to be carried on our red blood cells. Oxygen is carried in the blood in two ways, bound to the hemoglobin, and this is 98.5% of all the oxygen in the blood is going to be bound to the hemoglobin in a complex called oxyhemoglobin. And about 1.5% is dissolved in the plasma. So again, not a very effective way of transporting oxygen around the body. So as the blood moves into the body tissues, that partial pressure of oxygen drops dramatically. So as the arteries that are carrying oxygen-rich blood go through our muscle tissue in capillary beds, those muscle cells are going to be absorbing oxygen at a rapid rate, causing the amount of oxygen in our blood to decrease rapidly. This causes a dissociation of oxyhemoglobin, so that oxygen is going to break off that hemoglobin and absorb into the muscle tissues. So carbon dioxide is transported back from the body cells to the lungs in three different ways. So one is carbaminohemoglobin, which is about 27%. So this is when the carbon dioxide combines with the hemoglobin. So the hemoglobin that has given up their oxygen. 9% about is dissolved in plasma, and 64% as bicarbonate ions. And so this is what will change the acidity of the blood. So when the carbon dioxide combines with the water in our plasma, the carbonic acid is formed. If we have too much carbonic acid in the blood, our pH is going to drop to dangerous levels. And so due to an enzyme in the blood called carbonic anhydrase, carbonic acid further dissociates to become bicarbonate ions and hydrogen ions. The hydrogen ions dislodge oxygen from the hemoglobin and bind, producing reduced hemoglobin, which takes the hydrogen ions out, acting like a buffer so that our blood isn't becoming too acidic too quickly. But again, then we have the chemoreceptors in our medulla that are going to say, okay, we have a lot of carbon dioxide in our blood, time to reduce our oxygen rate. Once we're back in the lungs, the oxygen displaces the hydrogen from the hemoglobin. The hydrogen combines back with the bicarbonate ions, creating carbon dioxide and water, which then we exhale from our lungs during respiration. So we're going to take a look at a few different diseases and disorders of the respiratory tract. The first one is hiccups. These are spasms of the diaphragm that are thought to be caused by not enough carbon dioxide in the body, but nobody really knows 100% for sure. Hiccups we see sometimes being cured by breathing into a paper bag. Some people hold their breath. It just depends on what works for you. Fun fact, in 1922, Charles Osborne started hiccuping and continued hiccuping until 1990. Never found a cure, had a normal life, but he had the hiccups for 78 years. And another interesting fact is that fetuses in utero will often get the hiccups as well. Laryngitis is an inflammation of the vocal cords to where somebody partially or totally loses her voice. So again, the vocal cords are in our larynx. We can see them there. And as air goes past them, they'll vibrate and they can become sore, inflamed, and then we have alterations of the voice. So bronchitis can be caused by a bacterial or viral infection or environmental causes. So this is an inflammation of the lining of the bronchi, causing them to then oversecrete mucus, which turns to coughing. And this can be bad in the bronchioles where there's no cartilage, so they're much more inflexible. Pneumonia is an inflammation or infection of the lungs. Again, can be caused by bacteria or viral. And this is the lungs, air sacs, or the alveoli end up filling with pus and mucus, and they don't function properly. So people who have pneumonia will often have a very low blood oxygen because oxygen can't effectively filter from the alveoli to the capillaries. So pleurisy is an infection of the pleural membranes inside the chest cavity and coating the lungs. These are what separate the lungs from the chest cavity. Usually they're very slippery to aid in breathing, so it doesn't cause any pain. But when they're infected, they don't slide over each other as well, so breathing becomes quite painful. So asthma is an allergic response that causes a constriction of the bronchial muscles due to swelling, then reducing the amount of air that can get into the lungs and into the alveoli. So normally people, if they're having an asthma attack, you'll hear them wheezing for breath because the air is not moving effectively through the smaller tubes because of the constriction. So normally during breathing, the alveoli and bronchioles collapse due to that pressure change. But because of the mucus and swelling, breathing out becomes very hard. So when you have asthma, it's difficult to breathe in and difficult to breathe out. So emphysema is a disorder where you have a progressive loss of elasticity in the lungs. Typically, it's caused by a chronic infection or damage to the bronchial tubes due to continued environmental irritants such as smoking and or like workplace contaminants. So you end up with rupture of the alveoli, then it forms some scar tissue, and you have a decreased elasticity and decreased lung volume. And lastly, we have lung cancer. So we can see that here as kind of like that really white, hard lump. Lung cancer is more common in people who smoke cigarettes or who are consistently forced to inhale secondhand smoke. 85% of lung cancer is thought to be related to smoking. But people who often work around substances like coal dust, flour dust, bird droppings, asbestos fibers also frequently show much higher signs of lung diseases and lung cancer because, again, it's just a continual irritant that is getting into your lungs, causing long-term problems. Okay, well, that is the end of our chapter on the respiratory